Hi viewers, my name is Amina Yahaya. Good day and welcome to Manifest Talk on Manifest TV. Today we'll be discussing the state of the healthcare system in Nigeria in relation to the campaign promises of President Muhammadu Buhari. Before I introduce my guest to you, we'll go on a short break. Don't go anywhere. Welcome back. Our guest today is Babarinde Abdul Rahim. He is a medical doctor, a public health analyst, and an SDG advocate. He has over 5 years of experience in the Nigerian healthcare sector and is currently at the intersection between healthcare, finance, and works as a quality assurance officer for one of the leading healthcare insurance companies in Nigeria. He is passionate about the healthcare component of the SDGs and spends his time advocating for healthcare, quality healthcare services for Nigerians, especially as it relates to the universal healthcare coverage. Welcome.
Thank you very much.
President Muhammadu Buhari's campaign promises in the next level roadmap as it relates to health, centered around healthcare insurance, Empower Medic, and funding of health with up to 1% of consolidated revenue. Generally, how would you rate the performance of these priorities?
I think the performance of the administration, especially in regards to the next level agenda, hasn't been impressive. The performance has been quite poor because there hasn't been any significant improvement in the uptake of health insurance amongst the population. We're still dealing with the same pool of people that we had prior to the inauguration of this administration. So I think the performance has not been impressive.
The World Health Organization recommends that 15% of a country's total budget should be allocated to health. In your view, what are the obstacles that are hindering Nigeria from achieving this?
There are quite a lot of factors, actually. And what is quite ironical about this 15% budget benchmark for health expenditure is that it was made at what is known as Abuja Declaration. So this meeting and the agreement was actually reached right here in Nigeria. And unfortunately, since when this declaration was made, Nigeria has never ever met, this budget benchmark. So the budget benchmark is supposed to show government's commitment to healthcare. It's supposed to review how serious government is about healthcare delivery and how much it is willing to spend of its GDP on the health of its citizens. But we've always hovered around 3 to 5%, at most maybe 6%.
5%. That's very not encouraging, especially for a declaration that was actually agreed upon right here in Abuja in Nigeria. The National Health Act of 2014 stipulates 1% consolidated revenue fund to fund healthcare via the Basic Healthcare Provision Fund. Give us an overview of what this Basic Healthcare Provision Fund entails and its level of implementation.
Yes, the Basic Healthcare Provision Fund was actually like an intervention to create fiscal space for healthcare. We just mentioned that our budget benchmark has really been poor. So it was an innovative way to try and raise revenue and funding sources for healthcare services delivery. So according to the National Health Act, as you said, there is provision for 1% of all government revenues from all sources to be paid in what is known as the Basic Healthcare Provision Fund. Now, the Act goes further to stipulate how this fund is to be disbursed so that there is clarity in how the funds are to be managed and utilized for the provision of healthcare services. So 50% of that amount is to be given to the NHIS, that's the National Health Insurance Scheme, to provide what is known as the basic minimum package of healthcare services. Now, this is like the basic or the foundational level of healthcare, and it's targeted at meeting the primary healthcare facilities majorly. So the basic minimum package of healthcare is supposed to meet the needs of the poorest 40% of Nigerians through the primary healthcare system. the implementation and success of that is not yet to be seen, because I think only one disbursement of BHCPF has been made. So 50% to NHIS, 45% to the National Primary Healthcare Development Agency. That's the agency that is in charge of managing all the PHCs in the country. As you might be aware, the healthcare system in the country is such that we have primary healthcare, secondary, and then tertiary. The federal government is supposed to handle the tertiary healthcare level, while the state governments are handling the secondary level, and then the local governments. But we've had issues with the funding and the consistency and management of PHCs in the country. So the BHCPF was supposed to be an intervention towards purchase of essential drugs, maintenance of vehicles and utilities, and also maintenance of human resources at the PHC level. And then the remaining 5% of the BHCPF is supposed to be given to the emergency management organization in terms of emergency preparedness. As you know, we're in the middle of a pandemic, so such funds has to be earmarked for things of national emergency.
Wow, that's interesting. I'm learning a lot myself from the information that you're providing, and so far from the data and the statistics, it really doesn't look like we are doing so well in this aspect. According to the data from the National Health Account and other sources, out-of-pocket expenditure accounts for over 70% sources of healthcare funding. What is out-of-pocket expenditure in relation to healthcare services?
All right. Out-of-pocket expenditure simply refers to the amount of money you pay literally from your pocket in order to purchase or receive healthcare services. It's the money you pay directly to receive healthcare. So if you go to the hospital and you are asked to pay money for registration, for consultation, for drugs, for admission, whatever you've had to pay in the course of, getting healthcare services is out-of-pocket expenditure. And Nigeria has one of the highest rates, even in Africa, because in relation to health insurance and all that, a lot of people do not have access to prepayment plans that limits the amount of money they will have to pay in receiving healthcare. So what we have now is receiving healthcare based on ability to pay, which is not ideal, which is not the best in terms of healthcare development and overall development of the economy.
Yeah, while you were speaking, you mentioned that Nigeria is one of the countries that pays the highest. Why is it that high? Especially, considering that the World Health Organization stipulates that it should be between 30 to 40%.
No. The 70% that is being referred to is not what Nigeria pays. It's actually the deficit of what Nigeria is supposed to pay. So the World Health Organization says your out-of-pocket expenditure should not be more than 30 to 40% of the healthcare service you are receiving. So that means that if maybe you're sick and then you go to the hospital, you get treated and all that, and your bill comes to about 10,000 naira, for instance. What we have now says that you are going to pay 70% of that 10,000 naira yourself, while other funding sources and government sources will take care of the remaining 30%. But what should actually happen is that you are supposed to be paying 30 to 40% of that bill, and then other sources of funding and government intervention models and all the other health insurance and funding sources that you have will take care of the remaining bill. So what we have is a reversal of the role. Nigerians are paying an equivalent amount of what government should be responsible for in terms of giving them healthcare.
Incredible information. So what is the role of health insurance in all of these scenarios that you have mentioned? What exactly is the role of the health insurance?
So healthcare insurance is one of the prepayment models that is available to reduce out-of-pocket expenditure. When you have health insurance, the amount of money you would have to pay or the percentage you would have to bear yourself for receiving healthcare is greatly reduced. So health insurance employs what is called risk pooling and risk management, such that you bring people together regardless of their health risk and try to manage them so that enough resources is available to whoever needs it, not based on their ability to pay at the point of care. Because you and I know that there are times when you fall sick and you don't have anything on you, but you need to get better. You need to be fit and healthy to be able to work and earn income. So government needs to intervene to make sure that you are healthy enough to work and boost the economy of the country, and then the resources available to the government in the long run.
Interesting. Ladies and gentlemen, we still have Babarinde Ibrahim with us in the studio, and we'll be right back to learn some more after this short break. Welcome back, ladies and gentlemen. We still have Babarinde Abdurrahim with us in the house. Now, talking about still talking about health insurance. The data provided by NHIS shows that over 90% of Nigerians do not have health insurance, especially in the informal sector. Now, considering the promise to improve health insurance system via co-payment method, what is your perception about health insurance in Nigeria?
You see, the national health insurance coverage is abysmal. Is poor. I don't know. There's no other way to describe it, because I mean, after 20 years or so of the establishment of the national health insurance scheme, we're still dealing with less than 10% of Nigerians. And these are majorly, organized private sector, formal sector workers, federal government employees majorly, and then maybe members of the armed forces, some tertiary institutions, students. The bulk of the Nigerian population, which is constituted by the informal sector, you have the self-employed individuals, the plumbers, the welders, the mechanics, they are largely excluded from the scheme. And there hasn't been enough effort to absorb these people or find a way to incorporate them into health insurance. And these are the people who need health insurance the most. They are the most likely to be affected by adverse economic situations like this pandemic and several other circumstances that can affect their source of income and that can dwindle their resources, thereby limiting their ability significantly to purchase healthcare services, to get adequate, healthcare coverage. So the national health insurance coverage is very poor as of this moment.
Yeah, certainly. I mean, having over 90% not covered under this scheme, it's really worrisome. What do you think is responsible for this? Why do you think most Nigerians do not have health insurance coverage?
Okay, there are several factors responsible for the low coverage. I'm going to look at it from the direct and indirect factors, because the health insurance itself does not exist on its own. There are so many things that impinge on it. First of all, the legislation establishing the National Health Insurance Scheme, that's the NHIS Act, does not make health insurance mandatory. And that is a very serious problem, because unless you compel Nigerians sometimes to do something, they may not see the need for it. So that is there, and that is a serious issue that needs to be looked at from the legislative angle. Now, we have a very low level of awareness amongst the population. Nigeria is a country where people would rather cover themselves with the God they believe in rather than buy health insurance. People believe it is not my portion, it will not happen to me, rather than buy health insurance until the situation presents. So those are some of the things that have contributed to the poor uptake of health insurance. Then the National Health Insurance Scheme itself has not done a good job of publicizing creating awareness of its plans and how people can benefit from it. Now, the people who are already in the scheme that are even covered, that's the 10%, how are they faring? How is the program taking care of them? You hear about, stock outs, unavailability of drugs, poor quality of drugs, and there's this generally low trust or level of trust amongst the population towards government programs and government intervention. So a lot of these factors interact to limit people from, benefiting extensively from the health insurance programs, and also their ability. I mean, recent reports have suggested that over 65% of Nigerians live below the poverty line. That correlates, quite significantly with the level of health insurance coverage. You can only buy health insurance or pay down for your health care if you are able to feed. Someone who has not eaten, who is still looking for his daily bread, will not even think about saving for a rainy day when they will fall sick. So all these factors, poverty, lack of awareness, low level of education, then the amorphous nature of the informal sector, the lack of an avenue to capture them significantly under the scheme also contributes to the poor uptake of health insurance.
Well, thank you very much for that response. One of the reasons why we have these discussions is so the viewers at home can learn and they can have access to information when they need it. And still talking about healthcare insurance, we would want the viewers to learn from you. What are some of the health insurance programs that are available for citizens?
Okay, yes. The NHIS has quite commendably tried to roll out several programs, to try and show up the numbers and, increase the uptake of health insurance amongst the population. Personally, I feel the awareness of these programs and plans by NHIS has not been very much. The level of publicity that these programs have enjoyed is not so high so as for people to, key into the program. But some of the health insurance packages that, the NHIS has tried to come up with include the voluntary contribution social health insurance program, which is open to all Nigerians of all ages in whatever part of the country you are. As it says, it's a voluntary scheme. So you're supposed to voluntarily come and, pay premium and then get access to healthcare services when you need it. Then there's the tertiary institution social health insurance program, also known as TSHIP, which covers basically students in tertiary health institution. Then we also have the NHIS itself that covers the formal sector and also members of the armed forces. The private health insurance scheme that covers members of the organized private sector. These are people who are formally employed in one form of occupation or the other.
Because we're in the middle of a pandemic, I want to ask you this question. How or what are the implications of health insurance to the COVID-19 pandemic?
All right. Ordinarily, health insurance is meant to reduce the financial burden on any individual when accessing care. Health insurance are very paramount in countries where a significant part of the population lives below the poverty line, because there is something called catastrophic health expenditure, which simply means that, if someone is maybe average before they have their health challenge, and then getting health care for that health challenge means that they have to lose more than 40% or 50% of their household income, such that after meeting that health need, they are unable to meet other basic requirements of the household like education, feeding, and all of that. Catastrophic health expenditure pushes them down the poverty line. It further deepens them into poverty. So health insurance is meant to protect people from such healthcare expenditure. Now, with the outbreak of COVID-19, more and more people have had to seek healthcare, some of them without health insurance. So if there was a national health insurance program that covers, pandemics, just like we mentioned in the BHCPF, is supposed to, cover for emergencies. Such things would have easily been taken care of and people won't have to be responsible for their own healthcare in in managing situations like COVID-19. So health insurance plays a key role, not just for the individuals, but for the nation at large, in terms of protecting individuals and people from catastrophic healthcare that may further worsen their financial situation in the process of accessing quality healthcare services.
Wow. Thank you very much for being on our program today, Mr. Babarinde Abdurrahim. I have learned a lot, and I'm sure our viewers at home have also learned a lot. We hope that next time when we call on you, you'll be willing to come here and share information with us. Ladies and gentlemen, that is our show for today. My name remains Amina Yahya. Thank you for watching, and keep watching Manifest TV.